Hi everyone, this is Mr Neel Raithatha, also known as the Wax Whisperer. Thank you for joining me in this very interesting case. It was an emergency appointment offered to a patient yesterday. At the weekend, they were out with friends, and the patient advised that they all had a few too many to drink. And during the course of the night, one of his friends had a glow stick and, well, of course, inadvertently shoved it in his ear, and instantly the patient lost their hearing. There was extreme pain, otalgia, there was bleeding, and so Monday morning they called us straight away, and we said we'll see them. Now, you can see the eardrum's very heavily traumatized. I've just cleared some of the debris there, and that's the top part of the eardrum, but this is very angry, and it's very difficult even examining the ear, because you can imagine how painful it was for the patient. Now, the patient's main concern was whether they've got a perforation or not. So the idea behind the procedure is not to clear all this debris in terms of making it spotless. We're just trying to see what's going on, to see whether the patient has perforated their eardrum or not, because they're very concerned that they had. And so we're just trying to clear the debris, and I've just cleared more of the eardrum. And you can see how red and inflamed it is. On the left-hand side, it's really bulged, and it's not very happy, that part of the eardrum. And at the moment, you may have seen the perforation, but I am going to show you in a bit more detail. I'm just trying to get a bit more, again, I'm just being so gentle here. I'm just kissing the surface, and you can see the eardrum flexed a bit on the back part as I was trying to remove some of this blood, because I want to see the where the perforation is. The patient was convinced they perforated the eardrum. And I'm going to circle it in a moment. You will see it. It's a very small tear just below the umbo. Now, you've got the hammer bone, which is the first of the three bones, and that's attached to the eardrum. And in the centre, almost like the bullseye, there's a part of the hammer bone that attaches itself to the eardrum. We call that the umbo. And it's just below that. And even getting the endoscope in the ear was so difficult, because we just wanted to avoid contact with the canal wall, which is very heavily inflamed and tender. There we are. So it's a small tear, centrally, just below the umbo. And we're very hopeful, I'm very hopeful, that this will naturally and spontaneously heal for the patient. It can take 6 weeks, because the patient's quite young. And it's not, the perforation could have been a lot larger. Now, I just explained to the patient, there's a bit of dead skin here, obviously traumatized skin. And because it was in the outer part, we said that we'll try and remove as much debris as possible, but the moment it becomes a bit uncomfortable or tender, we would stop. So again, just using a fine end suction probe here. Now, in terms of the reason why the patient came, in terms of what we set out to achieve in the appointment, we've achieved that. We've established, we've cleared some of the blood and the debris deeper in the ear. We've established that they have got a perforation. So, and that makes a difference, because we've obviously had to write to the GP to have some medication prescribed. Now, you don't want to be prescribing the wrong medication when you've got a hole in the eardrum, a perforation. Most antibiotic sprays are what we call ototoxic. That means if these antibiotic drops enter the middle ear and the inner ear through the eardrum, it can cause permanent hearing loss. So now that we've established that there is a perforation, we've explained that to the GP in our referral letter, and we've recommended non-ototoxic medication. That could be amoxicillin, so oral antibiotics, or it could be ciprofloxacin. So that's it used to be for eye infections, but they're also they've got some ear drops, ciprofloxacin now. I probably haven't pronounced it very well. I'm not very good at pronouncing the names of these medications. So, and I've also advised the patient to see a colleague of mine, an ENT consultant surgeon, because if this doesn't spontaneously heal, they may need surgery. And we've just got to let this ear calm down now. So that's the reason for the antibiotics, anti-inflammatories. Just get this ear settled, because it's really angry, and we're hoping that this will heal. So I'm just having one final view. The patient found it a bit tender, so we just stopped. But we can see the eardrum now. And this is the image of the ear when the patient first arrived, and this is once I've cleared some of the debris, so we can see the perforation. Well, I hope you enjoyed that video, guys. And that's one of the reasons why we advise not to use Q-tips as well, because Q-tips can cause trauma to the eardrum just like that. So please don't put anything smaller than your elbow in your ear. It's an old saying, so inadvertently it means don't put anything in your ear. It's just going to do more harm than good. Take care, keep well, speak soon.